On this video, this is all about exploratory laparotomy mechanical obstruction. Exploratory laparotomy is a surgery to open up the belly area, which is the abdomen. This is the surgery done to find the cause of problems such as belly pain or bleeding. This testing could not diagnose. It is also used when an abdominal injury needs emergency medical care. So the topic outlined in this video are definition, etiology, cause, clinical manifestation, which is signs and symptoms, lab tests, treatment management, pharmacologic treatment, and complications.
Good day everyone, I am Erika Olasiman, we are Group G, and I will be the first reporter, followed by Montesino and Ondoy. Today I will be the one to discuss the exploratory laparotomy mechanical bowel obstruction. So exploratory laparotomy is an abdominal surgery that doctors sometimes use to diagnose abdominal issues. It is usually performed in patients with acute or unexplained abdominal pain. It can also be used for staging in patients who have sustained abdominal trauma and those with a malignancy. During the surgery, doctors explore your body's internal organs to find the cause of pain or bleeding. A mechanical intestinal obstruction is when the gut is completely or partially blocked. Pressure and discomfort are caused by a gradual build-up of food, liquid, and gas. If some blockage are not removed, the blood supply to the intestines may be cut off. Serious illness and intestinal tissue death could result from this.
Etiology or cause. So, scar tissue is the most common cause of small bowel obstructions. The abdominal wall or other organs are connected to the bowel through this tissue. As a result, the bowel struggles to function as it should. So, there are other causes of bowel obstructions. First is hernia. So, hernia is a part of the intestine pokes through the abdominal wall and squeezes the intestine shut. Next, bowel inflammation or swelling. So, inflammatory bowel disease is a group of disorders that cause chronic inflammation like pain and swelling in the intestine. Next is foreign matter in the intestines. So ingested objects that can get stuck in the digestive tract and sometimes perforate it. So foreign bodies may be accidentally or intentionally swallowed. Next is impacted feces. So fecal impaction is the result of severe constipation when you're unable to regularly pass poo, and it back up inside your large intestine. Next is volvulus. So volvulus occurs when part of the colon or intestine twists. So when twisting causes bowel obstruction that may cut off the blood supply to areas of the bowel. Next, intussusception. So this is a serious condition in which part of the intestine slides into adjacent part of the intestine. Next is tumors. So this is the blocking sa intestines. And gallstones. So the hardened deposit of bile that can form in your gallbladder. And the last is Crohn's disease, so a type of inflammatory bowel disease.
The first signs and symptoms of abdominal obstruction is abdominal pain. Any discomfort you have between your chest and groin is considered abdominal pain. This is frequently referred to as the belly or stomach area. Second is abdominal swelling. It is often caused by overeating than by a serious illness. Third is abdominal cramps. Kakili pain in the abdominal area comes and goes quickly. A patient may feel fine 1 second and then suddenly feel acute, sudden pain in the abdomen. Next is nausea. A person who experiences nausea may feel as though they are about to vomit. Also, when this sensation persists for a long time, it is called constant nausea. Next is vomiting. The contents of the bowel may be backed up into the stomach due to a blockage. This results in vomiting bile that is a dark green color or bilious vomiting. And bloating. This occurs when the digestive system's organs are stretched, when a liquid gas or solid accumulates in a region of your gut. Then, next is fever, a dangerous infection and inflammation of the abdominal cavity, commonly known as peritonitis, can also result from intestinal obstruction. This will happen if a section of your intestine has ruptured. Fever and intensifying stomach pain may result from this. Lastly is foul breath odor. A blockage in your intestinal tract can result in breath that smells like feces because of food that you eat cannot pass through your intestinal tract, in addition to the feces that are stuck inside your intestines.
So we have a lab test. So there will be a physical examination. You will be asked about your symptoms and medical history. To hear bowel sounds, a stethoscope will be put on your abdomen, and then intestinal blockage may be indicated by absent or unusual signal. So history and physical is the most formal and complete assessment of the patient and the problem. Is a shorthand for the formal document that physicians produce through the interview with the patient. And next is we have abdominal x-rays or CT scans. So CT scan of the abdomen can provide more detailed information about abdominal organs and structure than standard x-rays of the abdomen. So thus providing more information related to injuries and or disease of the abdominal organs. So we have complete blood count and serum electrolyte amylase and blood urea nitrogen. So during this lab test, technician will draw blood from a vein, typically from the inside of your elbow or from the back of your hand, and then the test will take only few minutes. The technicians cleans your skin with an antiseptic wipe, places an elastic band or tourniquet around your upper arm to help the veins swell with blood, and then insert a needle in you and collect a blood sample in one of more vials. Remove elastic band, cover the area with bandage to stop any bleeding. So barium enema, so is an x-ray exam that can detect changes or abnormalities in the large intestine. The procedure is also called a colon x-ray. So sigmoidoscopy or colonoscopy is a diagnostic test used to check the sigmoid colon, which is the lower part of your colon or large intestine. Instruction of procedure: X-ray or plain films. An abdominal X-ray requires no special preparation. You may need to remove some clothing or change into a gown for the exam. So like remove jewelry, removable dental appliances like eyeglasses, and any metal objects, so that not be interfere with the X-ray images. So next is air or barium enema. So before a barium enema exam, you will be instructed to empty your colon. So to empty your colon, you may be asked to follow a special diet the day before the exam. So you may be asked not to eat and to drink only clear liquid like water, tea, or coffee. So then past after midnight, usually you'll be asked not to drink or eat anything after midnight. Next is use an enema kit. So in some cases, you may need to use an over-the-encounter enema kit. So either the night before the exam or a few hours before the exam that provide a cleansing solution to remove any residue in your colon. And then you may ask your doctor about your medication and at least a week before your exam. So talk your doctor about the medication you normally take. And then serum electrolyte test. So healthcare professional will take a blood sample from a vein in your arm using small needle. Then we have white blood cell count. So is inserted into the vein and the blood is collected in an airtight vial or a syringe. So during this procedure, the tourniquet is removed to restore circulation. Once the blood has been collected, the needle is removed and the puncture site is covered to stop the bleeding. Serum amylase. So this test is divided into two tests, whether it is from the blood and pee. Step in serum amylase. So wrap a tight band around the patient's upper arm. Clean part of your skin inside the elbow area. Insert a needle into the area which may cause a stinging or pinching feeling. Attach a tube to the needle and fill in the tube with blood and remove the band and the needle. Put pressure in the puncture wound to help stop any bleeding and place a bandage on your skin. Then, healthcare provider may ask you to provide a clean cut urine sample in the office, or they may ask you to collect a series of samples over 24 hours at home. So to collect your urine, you should wash your hands, clean genital area with cleansing pad, pee a little bit into the toilet and then stop. And then put a special cup under the urine stream to catch some pee in the cup. Then wash hands again and then return the cup to the healthcare provider to testing. Next is physical exam. So the abdominal examination is performed with the patient lying supine. The examiner should begin by giving their formal introduction and then approach the patient and perform the examination from the right side of the patient. So wash hands thoroughly with the soap and water, and alcohol-based sanitizer can be used. Then identify the patient and briefly explain the reason for and step of the examination and take consent from the patient. Then inquire if the patient has any pain and position the patient initially positioned at 45 degrees for comfort but a supine position. And then The ideal exposure is from the nipples to the knees, but this is sometimes not practically possible. During most clinical examinations, the exposure is from the nipples to the lower abdomen. Next is computerized tomography. So, if your doctor ordered a CT scan without contrast, you can eat, drink, and take your prescribed medication prior to your exam. If your doctor ordered a CT scan with no. If your doctor ordered a CT scan without contrast, you can eat or drink. But if your doctor ordered a CT scan with contrast, do not eat anything within 3 hours prior to your CT scan. So, the last one is ultrasound. So, you typically need to avoid food and drinks for 12 hours before an abdominal ultrasound. So, food and liquid in your stomach can make it difficult for the technician to get a clear picture of the structures in your abdomen.
So the treatment management of exploratory laparotomy mechanical bowel obstruction may include the nursing goal care. So nursing interventions include monitoring vital signs, airway patency, and neurologic status. They also to assist the nutrition diet of the patient, manage the storage and privacy of patient's information, ensure that everything within the healthcare organizations runs smoothly, and ensure that health services within the organization are effective and utilized appropriately. And then we have the procedure. So the procedure include NGD feeding and catheterization. So we also have the AMDNA responsibilities. So AMDNA responsibilities, they taking vital signs from the patients, such as temperature, blood pressure, heart rate, and oxygen saturation rate. And also asking patient about their symptoms and relaying this information to a supervising nurse or physician. Recording observations in a patient chart, which becomes part of his or her ongoing medical record. And then feeding patients and monitoring their food and liquid intake, helping to turn, lift, or transport disabled patients or those with temporarily mobility issues, assisting patients with bathing, grooming, brushing their teeth, and other types of personal hygiene, assisting patients with wound care and some medical procedures, cleaning rooms, and maintaining a sanitized environment. And then encourage patient and assist in doing oral care. So pharmacologic treatment may include NSAIDs. Non-steroidal inflammatory drugs are widely used to relieve pain, reduce inflammation, and bring down high temperature. So the available drugs are about 200 mg, which is 1 pill every 4 to 6 hours. 220 mg, 1 pill for about 8 to 12 hours. And 325 mg, 1 or 2 pills every 4 hours, and 3 to 4 pills every 8 to 12 hours. And we have metoclopramide. Metoclopramide is the antiemetic and prokinetic drug of choice for symptomatic partial bowel obstruction. This medicine is available only with your doctor's prescription. So this product is also available in dosage from such as tablets, disintegrating, and with about 10 milligrams for 4 times a day, taken 30 minutes before each meal and at bedtime for 2 to 8 weeks. So, nursing assistant may assess for gastrointestinal complaints such as nausea, vomiting, and constipation. And we also have morphine sulfate. This is the drug of choice for anaglasia due to its reliable and predictable effects, safety profile, and ease to reversibility with naloxone. So this drug is available for about 50 to 30 mg every 4 hours if needed. Nursing assistant may take vital signs including heart rate and blood pressure, oxygen saturation, and respiratory rate and pain relief. Pain relief should be monitored before, during, and after morphine administration. And we also have antimuscarinic, anticholinergic drugs, which is atropine and scopolamine. These are used to manage colicky due to smooth muscle spasms and bowel distension. This medicine is only available according to a doctor's order and over-the-counter prescription. This is also available from 0.3 to 0.6 mg by oral and 0.2 mg parental. Nursing assistant may monitor and assess the patients toward the drug that have been prescribed, assess patients' the vital signs. And we also have antimuscarinic, anticholinergic drugs, which is atropine and scopolamine. These are used to manage colicky due to smooth muscle spasms and bowel distension. This medicine is only available according to a doctor's order and over-the-counter prescription. This is also available from 0.3 to 0.6 mg by oral and 0.2 mg parental. Nursing assistant may monitor and assess the patients toward the drug that have been prescribed, assess patients' the vital signs. And somatostatin. This is a natural peptide hormone used to treat acute bleeding from esophageal varices, gastrointestinal ulcers, and gastritis, prevent pancreatic complications, and IV fluids. And antibiotics, this is to help clear and infections. And then antiemetic, it should be administered for symptomatic relief, usually in conjunction with GI decompression via placement of an NG tube for suction. So this may include anxiety drugs such as benzodiazepines, diazepam, or buspirone are useful for the anxiety. So we have Dulcolax syrup. This is to treat constipation and may also be used to clean out the intestine before a bowel examination or surgery. Bisacodyl is known as stimulant laxative, and it works by increasing the movement of the intestine and helping the stool to come out. So this is the last part, which is complication. Complications may include dehydration. Dehydration occurs when you use or lost more fluid than you take in, and your body doesn't have enough water and other fluids to carry out its normal function. So if you don't have replace lost fluids, you will get dehydrated. And then electrolyte imbalance. Electrolyte imbalance occurs when you have too much or not enough of certain minerals in your body. This imbalance may be a sign of a problem like kidney disease. Electrolytes are minerals that give off an electrical charge when they dissolve in fluids like blood, urine. And then infection. An injection is the act of administering administering a liquid, especially a drug, into a person's body using a needle. So this is usually used in hypodermic needle and a syringe. And then we have peritonitis. Peritonitis, inflammation of the perineum, a silk-like membrane that lines in your inner abdominal wall and covers the organs within your abdomen. This is usually due to a bacterial or fungal infections. And then we have the sepsis. So sepsis, the body's extreme response to an injection. It is a life-threatening medical emergency. Sepsis happen when an infections will already have triggers a change reaction throughout your body. Infections that lead to sepsis most often start in the lung, urinary tract, skin, or gastrointestinal tract. And then we have the bleeding. Bleeding is the loss of blood. Bleeding may be inside the body internally and outside the body externally.